Hi everybody, I'm Amanda G, PsychMP, and welcome to my YouTube channel, Mental Health Matters, where we talk about all matters related to mental health. Today I wanted to talk about complementary or alternative treatments for mental health. This is a really broad topic that a lot of people are interested in, and there are some really important things that you need to know when considering complementary or alternative treatments. So let's get into it. Being a psychiatric nurse practitioner, I am licensed to prescribe medication and I also perform different modalities of therapy. I really strongly support using alternative or complementary treatments when addressing mental health issues. I think there's a lot of things out there that we can use that are homeopathic, that have been proven to work and are effective in conjunction with other evidence-based treatments. A lot of people are interested in complementary or alternative treatments because it's things that they can do at home. And that's the really cool thing about it, is that you can take some control and you can help yourself at home. Some common herbs and supplements for treating mood disorders would be that of St. John's wort. This has been known to treat depression and has been around for hundreds of years. What's really cool about these treatments is that, a lot of them were around before we had traditional medicine and kind of like old wives' tales, but a lot of them really do work. So St. John's wort is one that can help treat depression. Another one is ashwagandha root, and basically that can help with the nervous system and help treat anxiety and sleep. Another one that's very popular is called valerian root, and valerian root is kind of touted as God's Valium, and it can really help reduce anxiety, and you can use it in a rescue medication type. Another alternative treatment for anxiety specifically is called tapping, and it is based off of the idea that we have pressure points on our body. And so I like this because you can use it for kids, but you can also use it for yourself pretty much anywhere you are. And this would be if you're having a panic attack or some anxiety, and you actually tap. You tap in the center of your forehead, along the eyebrow, underneath the eye, underneath the lip. And these are all pressure points. So it's kind of using that ancient Chinese medicine that has been around for thousands of years that really works. Like I touched on in my last video, are that of vitamins and supplements. Making sure that we've got a good solid base, that we've got good iron levels, that we've got good vitamin B and B12 and B6 levels, that we've got good magnesium levels. These are complementary treatments, but they're also going to help overall mood and are something to consider. Something that really has taken off in the last few years and become very popular is that of essential oils. And I myself am an absolute oil head. I love oils. I've been using them for about 10 years. They trigger certain parts of our brain that can help reduce anxiety, reduce stress, help with focus, help with attention. Things like lavender, a lot of people have heard of that, can help with anxiety and stress. Citrus smells can help brighten your mood and help with depression. Peppermint can help with focus and attention. So definitely essential oils are things that you could add. Another really great addition that you could add would be yoga, meditation, exercise. Now, I know I am really bad at meditating because I have to calm down and breathe and kind of be mindful and let my thoughts wander, and that's really difficult for me. But there's all sorts of apps. There's Headspace. There's a few apps if you look on your phone that you can download for free that can kind of walk you through guided meditation. And these are really great alternative or complementary treatments when trying to address anxiety, panic, depression. Of course, yoga, that's been around forever and it's pretty mainstream now. Everybody knows the benefits that you can get from yoga, not just for mind, but for also body. And then just exercise in general is a great stress relief. And, it actually releases endorphins that kind of give us that energy and feel good feeling that can help with mood. Another alternative treatment that is huge right now is that of CBD, which is an extract from the marijuana or the hemp plant. And the CBD that I really recommend, that I use and that I recommend to patients, is that without any THC. So there's no psychotropic effect. And we know that in our body we have cannabinoid receptors, similar to opiate receptors, nicotine receptors. So if you are deficient in that area and you add CBD to your treatment, you can actually have a reduction of anxiety. I personally use it for pain. I have a chronic migraine suffer, and it helps relieve my pain. You can use it for sleep. So adding that to your treatment plan can also help. One really important thing that I want to mention is that if you are going to add complementary or alternative treatments to your regimen, discuss them with your provider, because some of these supplements, CBD, St. John's wort, they can have interactions with other medications that you're taking. So that's why it's really important when I do an intake for someone, I'm always asking what medications and what vitamins and supplements. So I also really like to consider the fact that alternative or complementary medicine can be used in conjunction with evidence-based medicine in terms of traditional medications and therapies. There are going to be some disorders where that's not going to be enough. You know, if we're bipolar 1, if we have schizophrenia, if we have severe anxiety disorder. But the cool thing about alternative or complementary medicine is that you can use it with other treatments. Thanks everybody for watching this video on complementary and alternative medicine. There are many different treatments out there, and it's important to discuss it with your mental health professional to see what would best suit you. Really, for me, when I'm working with an individual, it's all about coming up with the best customized treatment plan that's going to work for you and suit your needs. So if you have any questions or any comments, just put them in the link below. I'm going to be making more of these videos for you. Let me know if there's a specific topic that you want to talk about. And thanks so much for checking out my channel. I'm Amanda G. PsycNP. This is Mental Health Matters, where we're going to discuss all matters related to mental health. Talk to you soon.